And finishing up today, we have Chapter 16 Cholinergic Agonists and Antagonists. When discussing cholinergic agonists, we're talking about the parasympathetic nervous system. And these cholinergic agonists function to mimic the parasympathetic neurotransmitter acetylcholine. They also work on the cholinergic receptors, such as the muscarinic receptors and nicotinic receptors. These cholinergic agonists can have two forms, direct acting or indirect acting, which inhibit the action of the enzyme cholinesterase. The parasympathetic nervous system acts on many areas. In the cardiovascular system, it decreases the heart rate and blood pressure, causes vasodilation, and slows the conduction of the AV node. Within the GI tract, it increases tone, motility, peristalsis, and relaxes the sphincter muscles. And then within the genitourinary system, it increases ureter tone, bladder contractions, and stimulates urination. Within the eye, it causes pupil constriction and increased accommodation. For the lungs, it results in bronchial constriction with increases in secretions. For the glands, such as increased salivation, perspiration, and tear production, as well as the striated muscle, which increases neuromuscular transmission, increasing strength and tone. Direct acting cholinergic agonists are primarily selective to muscarinic receptors. By muscarinic receptors, we mean receptors located within the smooth muscles, such as the heart, GI, genitourinary tract, and the glands. Our first medication we'll discuss is bethanechol. It has side effects such as hypotension, diaphoresis, increased salivation and gastric acid, nausea, vomiting, diarrhea, abdominal cramps, and most importantly, bronchospasm and wheezing. Its contraindications are conditions like bradycardia, hypotension, peptic ulcers, Parkinson's, hyperthyroidism, and urinary tract obstruction. Bethanechol, when used in elimination, we need to assess our baseline vital signs for any future comparisons and obtain a thorough patient history of health problems. We're going to prioritize the conditions urinary retention and hypotension, such as solutions, and our goal being the patient will void with more frequency after taking this. We want to monitor the blood pressure and heart rate carefully due to its effects on the cardiovascular system. We also want to teach the patient to rise slowly from a lying position to avoid dizziness and orthostatic hypotension. Auscultate the breath sounds for any adventitious sounds like rails, crackles, such as from fluid congestion within the lungs. And also monitor the patient for any possible cholinergic crises like his overdose, overcorrections, including symptoms of muscular weakness or increased salivation. For our indirect acting cholinergic agonists, these work to inhibit or inactivate cholinesterase enzymes. This affects skeletal muscle contraction, increased muscle tone, bronchial constriction, bradycardia, increased GI motility, and again, promoting urination. It has uses such as promoting pupil constriction in glaucoma and increased muscle strength in patients with myasthenia gravis. Our side effects are going to be bradycardia, hypotension, hypersalivation, sweating, anorexia, nausea, vomiting, abdominal pain, and diarrhea. In the case of irreversible cholinesterase inhibitors, these are potent agents due to their long lasting effects that may last days or weeks. The action, again, inhibits the acetylcholine by occupying receptors and is used to produce pupillary constriction. In the case of cholinergic antagonists or anticholinergics, these inhibit acetylcholine action by occupying the acetylcholine receptors. They affect many systems, such as the heart, where large doses increase heart rate, while small doses decrease the heart rate. Within the lungs, causing bronchodilation and decreased secretions. And within the GI tract, where they relax smooth muscle tone, decrease motility and peristalsis, and decrease secretions. For the genitourinary system, they work to relax detrusor muscles, increase sphincter constriction, while in the eyes, they dilate pupils and decrease accommodation. They also have effects on the central nervous system, such as decreasing tremors and the rigidity of muscles, as well as in the exocrine glands, where they decrease salivation and perspiration. Our next anticholinergic is going to be atropine. This is a medication we're going to talk about a lot in this term, as well as even deeper once we get into med surg and cardiac next semester. For atropine, this is a drug that's primarily designed to increase heart rate in emergencies. It also has effects on pupil dilation and side effects such as decreased GI motility, spasms, peristalsis, and salivary and gastric secretions. Dry mouth, dehydration, headache, as well as tachycardia, blurred vision, and photophobia are common side effects. It can also have effects on the urinary system, resulting in urinary retention and constipation. Anticholinergic drugs are often used in Parkinson's disease, such as selected anticholinergics like benztropine. The action is to decrease involuntary movement, tremors, and muscle rigidity. They have similar side effects, such as dry mouth, headache, blurred vision, photophobia, tachycardia, ocular hypertension, and again, urinary retention and constipation. Anticholinergics also have a use in treating motion sickness, such as the antihistamine scopolamine, which is a transdermal patch that delivers doses over 3 days, used for things like motion sickness, nausea, vomiting, and also has side effects like dry mouth, drowsiness, visual disturbances, tachycardia, hypotension, and urinary retention and constipation, if you're noticing a theme here. For atropine, its most common use is going to be in perfusion and increasing that heart rate. We need to be assessing these patients for very closely for any adverse effects, like assessing urinary output as urinary retention may occur, and obtaining a thorough medical history. We also want to keep a close eye on the patient for any decreased visual acuity and monitor the patient's heart rate closely as it will be increased. Anytime we're giving atropine, we're going to monitor vital signs, urinary output, bowel sounds, and maintain safety, bedside rails, driving motor vehicles, as they may get dizzy. Provide mouth care and eye drops, avoid hot environments, and wear sunglasses in bright light. For our first practice question, a patient has received atropine. It's most important for the nurse to assess the patient for which effect: A, anxiety, B, constipation, C, urinary retention, or D, impaired oral mucous membranes. And that answer is going to be C, urinary retention. For question two, a nurse has just administered atropine to a patient. It's most important for the nurse to assess the patient for the development of which adverse effects or which side effects: A, nausea, B, tachycardia, C, rails, or D, hypertension. And that answer is going to be B, tachycardia, as that's going to be our biggest danger with this medication. A patient is ordered to receive methanocal chloride for urinary retention. Which health condition would serve as a contraindication for this medication? Would it be A, asthma, B, hypertension, C, diabetes, or D, chronic allergies? And that answer is going to be A, asthma. This is a medication that can cause bronchospasms, and we want to avoid any medication that can cause bronchospasms at all costs with any patient that also has asthma. A patient received atropine as a preoperative medication 30 minutes ago. Which of the following statements by the patient indicates to the nurse that the medication was effective? That be A, I feel like I need to throw up, B, I need to urinate, C, my mouth feels dry, or D, I have a headache. And that answer is going to be C, my mouth feels dry. As you remember with these cholinergics and anticholinergics, the effect they have on the salivary glands. For question five, a patient is prescribed scopolamine. It is most important for the nurse to assess the patient for a history of which condition? That be A, diabetes mellitus, B, glaucoma, C, allergy to penicillin, or D, gastric ulcer. And that answer is going to be B, glaucoma. And finally, atropine is most useful in the treatment of which cardiovascular condition? That be A, ventricular fibrillation, B, first degree heart block, C, premature atrial contraction, or D, sinus bradycardia. And that answer is going to be D, sinus bradycardia. I know we haven't covered all the different dysrhythmias yet, but don't you worry, we're going to be going very in depth with each of those later in the program. But for right now, yeah, as soon as you see atropine, immediately be thinking bradycardia. We need to increase that heart rate. But anyway, that's all I got for this chapter. I'll see you in the next slides.